Good evening, everyone, and welcome to 365 Live. I'm Bina, and I'll be your host for tonight's session. This is a gentle reminder that all information shared at this event by the speaker and 365 CPS is for general information only. Please consult your doctor for personalized and detailed medical advice. Without further ado, I'm pleased to introduce tonight's speaker, Dr. Francis Chin, Senior Consultant Specialist in Radiation Oncology Palliative Medicine at Icon Cancer Center. He's here tonight to share all about gastric cancer, including its myths and treatments. If you have any questions, please feel free to post them in the chat, and Dr. Chin will address them during the Q&A session. Hi, Dr. Chin. Thank you
Hi,
very
Bina.
much. Hello, thank you very much for joining us tonight to share your knowledge with everyone. So, like our audience before their screens, I'm very keen to learn about what I can do to prevent gastric cancer and how I can spot any early warning signs. So, let me hand over the time to you now. Dr. Chin, please.
Thank you, Bina. Thank you very much, 365, for this opportunity to talk to everyone online. I hope you all have a good evening. My name is Dr. Francis Chin. I work for Icon Cancer Center. And tonight, the talk that I'm giving is gastric cancer, myths and treatments. This is what we need to know. You need to understand what gastric cancer is before it gets to you. And this is what I will talk to tonight. What is gastric cancer? What are some of the common causes of gastric cancer? Some signs and symptoms of gastric cancer? How to prevent gastric cancer, detect gastric cancer, and what to do when gastric cancer strikes. So what causes cancers in general? Cancer is when there are malignant growths or tumors caused by abnormal and uncontrolled cell division. Sometimes it could be inherited and genetic syndromes caused by what we inherit from our family with family. But most of the time, cancers are caused by environmental factors, which include lifestyle and dietary. For example, smoking and bitter nut use. Sometimes our work will predispose if you work in heavy industry, petrochemical industries, exposures to asbestos, benzene, sawdust can also predispose to cancers. And then some infectious agents like hepatitis, human papillomavirus, HIV, and especially for gastric cancer, there is an infectious agent, a parasite called Helicobacter pylori. If you have Helicobacter pylori, the chances of gastric cancer increase almost 200% compared with someone without any cancers. Having said that, genetic causes account for maybe only 5 to 10% of all cancers. So this is just a schema showing the two developments: sporadic cancer, which is the normal cancer that develops in 80% of all patients, versus hereditary cancer, which is in 5 to 10%. Each of us inherit a gene from our father and mother. In hereditary cancers, if in case one damaged gene is already inherited from either our parents, the chance of another damaged gene happens early in life. And when that happens, the tumor develops early. So if you are someone who is young and developing gastric cancer at the age of 30 or 40 years old, it is highly likely that you have a hereditary cause of gastric cancer, having inherited one abnormal gene from your parent. Most gastric cancers occur in elderly patients, and we have two normal genes that require what we call a two-hit hypothesis. As we grow older, one of our genes may be damaged, but another serves as a backup. And then later in life, around age 60 or 70, another damaged gene results in tumor developing. From a normal cell, it is a multi-step process that leads to gastric cancer developing and all cancers developing. There's an initiation phase, and one of the common initiators for gastric cancer is gastritis or gastric disease. I've talked about the parasite Helicobacter pylori, which creates ulcers and promotes the proliferation of genetically unstable cells, and then they invariably progress over the years into gastric cancer. So it is something that happens over months and years, and the implication is that it is something that can be detected early during screening. And if there is early detection, what it means is that we can actually treat it earlier, and the chances of cure is actually much higher. So there are usually 7 capabilities that a cell needs to have before we can say that there is cancer. And this is just a schema of some of them that the cancer needs to develop. The estimated number of cancer cases worldwide is increasing year by year. And these are the Singapore numbers. Although gastric cancer is not one of the top 10, gastric cancer is one of the top 10 in Singapore, is not one of the top 3. So there are, it is quite an important cancer, both in male and female. And it is also quite important in terms of mortality. Gastric cancer or stomach cancer is here. And over the years, the number has been decreasing. Cancer remains the number 1 killer in Singapore. And the number of 1 in 3 Singaporeans die of cancer every day. 14 people die of cancer every day, and then 28 people are exposed to cancer every day. These are numbers from the Ministry of Health. How does cancer develop? They usually develop, and I alluded, because of DNA damage, and then this DNA controls normal cell growth and death. In cancer cells, these mutations are not repaired, and repeated exposure through smoking, through viruses. I've talked about Helicobacter. In most cases, we do not know the exact cause of cancer in many of our patients. There are many types of cancer. Today, we'll talk about gastric cancer, but I just like to touch that that different cancers need different treatments aimed at a particular type of cancer. What are some of the signs and symptoms of gastric cancer? Gastric cancer can be silent in the early stages. That's why early detection is difficult. As the cancer grows, more noticeable symptoms may appear. Some early signs, which are often overlooked, are very non-specific and it resembles very common gastric conditions like gastritis or indigestion. If you have some of these signs, like persistent indigestion or heartburn, it feels like a bloating or burning sensation in the upper stomach, or you feel full after eating small amounts of food. This is what we call early satiety. It may mean that the stomach cannot expand normally. You may have a vague, mild discomfort of the stomach. It may come and go, and you may not notice it. It may be accompanied by loss of appetite, especially associated with nausea and discomfort. There may be unexplained weight loss, tiredness, or fatigue. This may be due to slow blood loss or poor intake. As I mentioned, these are very common conditions in stress in Singapore, and many people with stress at work may think that this is not always due to cancer, but if some of these symptoms persist and they last for many weeks, you should actually go and consult your doctor and get a medical checkup. Some of the more advanced warning signs that may suggest that cancer is growing is if there is unintended weight loss, and you are losing weight despite eating, it may be due to poor intake or due to the cancer metabolism, which acts as a parasite, taking nutrients from you. If you have stomach pain, especially pain that is persistent and dull and worsening over time, if you have nausea and vomiting, sometimes accompanied with blood red or coffee ground appearance, or if you pass black stools, that is a sign of bleeding in the upper digestive system. Difficulty in swallowing could be related to a gastric cancer occurring at the junction of the stomach and esophagus. In some of the late cases, there may be even swelling fluid in the abdomen. How to tell if some of these signs are serious? On this table, there are some symptoms like bloating, stomach pain after spicy food, feeling full quickly, vomiting blood, and black stools. Some of these are rare as common gastric symptoms. Some of them are rare, and the degree of if you have bloating, which is very common, it is only important if it's persistent. But if it's something like black stools, you should actually see the doctor as fast as you can. What are some of the treatment options? Surgery remains the first modality for early cancer. Radiation therapy works really well. In some patients, we use chemotherapy. There are many new drugs, including targeted therapy, immunotherapy, as well as even newer drugs, antibody-directed therapy. How do we diagnose gastric cancer? Usually, it involves an endoscopic examination, and then we biopsy suspicious areas. Sometimes it is picked up by imaging, which may take the form of a PET scan or CT scan. Blood tests sometimes can be diagnostic and useful. Imaging and colonoscopies, and then there are many stages, from stage 0, where it just involves mucosa, all the way to stage 4, depending on the depth of invasion of the muscle wall and if it has invaded into adjacent organs. The importance of catching gastric cancer in the early stages, which is from stage 0 to stage 2, is very important because the cure rate is much higher compared with when it is actually in stage 3 or stage 4. In Singapore, gastric cancer is the 7th most common cancer in males and 9th most common in females. It has a high mortality rate and is ranked as the 5th most common cause of death in both men and women. The overall incidence is actually, as I've alluded, is declining globally, but locally the numbers suggest that Chinese males are at a higher risk compared with other ethnicities. Usually it develops when you are more than 50 years old, but we have a subgroup of younger females which tend to be more aggressive and tend to be diagnosed in the more advanced stages. These are the treatment options: surgery, chemotherapy, immunotherapy, targeted therapy, radiotherapy, which involves using X-rays to treat cancers. Very important as well, supportive care and nutrition post-op, whether it's after treatment or during treatment itself. These are some of the pictures that you expect when you do a gastroscopy. Bowel prep needs to be done such that the bowel is empty, and you can see angry looking cancers. That you can see polyps developing at the areas, and then the dry blood in some of these areas. What are some of the myths and misconceptions of gastric cancer? Some of the myths I list out below, that some people say that gastric pain always means cancer. The truth is that most gastric pain is benign, but persistent cancer pain should be checked. The myth is that only older people get gastric cancer. The truth is that the risk increases with age, but it can occur in younger people too, as we have some that are due to familial or inherited syndromes. One other myth is that spicy food always causes cancer. It is not directly correct, but if chronic gastritis may play a role, and persistently taking spicy food may cause persistent injury to your stomach and may actually predispose and promote gastric cancer. One other myth is that nothing can be done if it's diagnosed late. We will still encourage to do screening because early treatment will have better. But even if it's stage 3 or stage 4, new treatments are always being developed. New trials are being and have very encouraging results. And early action is still helpful to actually alleviate the symptoms and treat gastric cancer. How can I reduce my risk of cancer? Number 1, adopt a healthy lifestyle, good diet, reduce in processed meat, eat more fruits and vegetables, limit your alcohol use, and then don't smoke. Okay? Treat Helicobacter pylori if it's detected. Nowadays, there are breath tests that you can take, and these are usually detected or tested in people with persistent gastric pain. And after every colonoscopy, gastroscopy, they would test for H. pylori as well. Who should go for screening in Singapore? If you have a family history of gastric cancer or hereditary syndrome, you should actually be screened early. But in general, if you have symptoms or one of the signs mentioned, you should ideally go for a gastroscope. Early detection equals better cure rates. So talk to your doctor, especially if you have a family history or if history of chronic gastritis and any of the above risk factors. 365 has a gastric cancer screening program, and you can sign up on the QR code. There are certain screening eligibilities, but if you are CHAS card blue or orange, you may qualify for a free gastric cancer screening. Go and check out the 365 website for more information. 8 cancer prevention tips. Number 1, do not smoke. Number 2, adopt a healthy body weight. Number 3, eat more fruits and vegetables. Number 4, be active. It has been shown that moderate exercise reduces the risk of cancer. Number 5, limit alcohol use. 6, protect yourself from the sun. This is especially important for skin cancers, which are common in Singapore as well. Number 7, follow all screening recommendations. Number 8, get yourself vaccinated in those, especially if it is related to infectious agents. And relating to gastric cancer, if they find Helicobacter pylori, it can be treated with antibiotics. Do not smoke. Adopt a healthier lifestyle. Brisk walking, cycling, swimming, taking the stairs. Eat healthily, at least 5 servings of different vegetables and fruits every day, and limit the intake of red meat. Reduce your intake of processed foods, decrease your salt intake, and try natural seasonings instead. Mind your body, get early detection, recognize the warning signs and symptoms, and do the cancer screening as indicated. Now there are 4 major cancer screening programs in Singapore: cervical screening program, breast screening program, colorectal screening program, and prostate and lung may actually be soon. There may be a screening program. Adopt a balanced diet. choose whole grains over processed food, limit your consumption of processed food, and eat lots of vegetables and fruits. Be active. Okay, moderate exercise. 365 has an exercise program that been running for over 20 years. And even children and adolescents be in a group activity, engage in at least 30 minutes of moderate exercise every day. How do you screen? This screening, breast, cervix, colorectal. Why do we screen? Because early detection equals to early diagnosis. Early diagnosis equals to early treatment. Early treatment means a better chance of cure. There are some disadvantages of random screening. So consult your doctor if you are not sure what they are. They will consider your age, family history, medical history, general lifestyle, and health risks, and then bring up to your family doctor any concerns that you may have so that informed decision can be made. The take-home message, this is my last slide, cancer affects everyone. Beware of the subtle signs because early cancer has very little symptoms. The myths can be dangerous. Get the facts from your doctors. Early prevention and early detection are key. Adopt a healthy lifestyle and behavior. Discuss with your healthcare providers and go for screening if you can. And the last one, go for any vaccinations if you can. This is me again. I hope to take some questions from everyone. Thank you. I can be contacted at this email or you can scan.
Thank you, Dr. Chin. If anyone has any questions, please feel free to share them in the comments and we will invite Dr. Chin to address them accordingly. So while we wait for the audience to share their questions, I have a question for Dr. Chin. So you mentioned screening for gastric cancer. How often should we screen for gastric cancer? So after maybe 50, you go for your first checkup. Is that like done? You're clear forever, or like every few years you have to go back
Okay,
again?
so currently there are no adopted guidelines for gastric cancer screening, but they tend to be uh, in conjunction with colorectal screening. So there is a program that after 50, that someone will get colorectal screening. As we see from the live tables, colorectal is one of the top 3 conditions of both male and female in Singapore. And usually we say that you need to do a scope. When you do the scope, it is very common for the surgeon to actually do what we call a down scope as well as up scope. So you actually, lots of people, when they do colorectal screening, they also get up scope as well to actually screen for gastric cancer. And usually, if without any risk factors, that we usually do not say that you need to start screening because there's really the people that we picked up a lot of gastric cancer is if they have some symptoms, heartburn, gastritis is actually one of the symptoms leading to a scope and then the discovery of an ulcer. And then we biopsy and see whether this is early ulcer or is something more malicious, the stage 1, stage 0 that I was alluding to that may develop into gastric cancer.
Okay, thank you. So on a related note, you mentioned we screen using gastroscopy, and sometimes it's like, done alongside colonoscopy. So Christopher has a question on whether is there a blood test for gastric cancer screening that is like
Um,
non-invasive, I guess.
Okay, so there are tumor markers that we use, and it is not very common at this moment using it. There are what we call CEAs, CA19-9. There are some very non-specific tumor markers. The pickup rate is not very high. You may, and I wanted to address this, there are actually now commercial DNA screens, and I think 365 also offers a version of this, a multi-cancer screen, which it is a blood test, but they look for DNA strands of common cancers. And I think gastric cancer is one of them. There are certain commercial products where they say that you can screen for 12 or even 50 or types of common cancers.
Mm.
So there is a blood test, DNA strand, but it's extraordinarily expensive at the moment.
Mm. So, what is there a like gold standard for gastric cancer screening? Is that the
The gold
gastroscopy?
standard for gastric cancer screening is still gastroscopy
Mm.
and then a
Okay.
biopsy, visualization biopsy.
Mm. Okay. Thank you. And we have a question from Claire and Menghui related to food. So, would in eating raw food like sashimi or eating like
Okay,
spicy food
yes.
over a long
So
time?
I'm going to address this, and
Mm,
the answer is yes. Eating raw food, spicy food, and this is data from Japan, Korea. They have higher levels of gastric cancer uh, compared with the rest of Asian populations, which we would relate that they probably have higher raw food intake. And of course, I don't know whether now in Singapore we actually take a lot of Japanese food, including sashimi. If anything, I think we probably take more sashimi than the average Japanese. For them,
mm,
sashimi is something that they take once in a while, like a Chinese New Year dish. You know,
mm,
while we know some families who eat sushi every week. Yeah, so we don't know whether raw food, and I would advise and I will tell, and I'm as a parent, I will ask my kids not to take raw food
mm,
because it is not very, of course, it tastes delicious, but it's not really healthy for young kids to
mm,
actually eat raw food and having wasabi as well. So
mm,
it is backed up by data that it causes an injury.
mm,
And the other thing about raw food, of course, it needs to be processed well.
mm,
There is actually parasites in the fish that we do not see. Uh, and I think there was a very famous viral story of donkey where there were, worms crawling out, and the supermarket actually said it is an acceptable amount, which is actually true. There are certain biogrades of acceptable amount. The idea is that you put it in your stomach and the gastric juices will kill the parasites, but or they would actually freeze it. So there are, of course, that's why we need good food safety standards.
mm,
But as more and more of these foods come in from Singapore, invariably we can only sample a small amount of food. We cannot check every single batch.
mm,
So it is very common sense. It is likely these spicy foods
mm,
will lead to a higher increased risk of gastric cancer. But having
mm,
said that, all of us eat raw food, but not all of us get gastric cancer.
mm,
So invariably, there is good food safety standards in Singapore, uh, and also there is a predisposition required.
mm. Is there like a recommended frequency, like maybe for raw food once a month, or like
So the
if you
recommended
really want to eat?
frequency, okay. So in the end, it's
Mm,
about whether the food is well prepared.
mm,
If it is not well prepared or it's not a reputable source of raw
mm,
foods, even once you can get
yes.
salmonella poisoning, and
Mm,
it is very common, and it's very not in Singapore, but it's very common
mm,
in overseas, especially in Thailand and Cambodia, to
mm,
have parasites in their seafood.
mm,
Because they catch them in the paddy fields.
mm,
So they have what you call schistosomiasis. It's a very scary thing that can drill into your blood and find its way to to all your
mm,
muscles and brain. So parasites are very scary. It's just that we have not seen this already. So my best advice to anyone is to use your common sense
Mm,
to eat at a reputable center, which you
mm,
hope that they have high standards. And I always say, you do not eat uh, sashimi in a place like Cambodia, which is a landlocked
mm.
area. Yeah, yeah.
Yes.
So do your own research. Yeah,
Mm, mm,
there isn't a recommended. Of course, some people say I eat sushi every week and
mm,
no problems, but
mm,
that it is not very healthy to
mm,
ourselves to actually eat raw food all the time.
mm. Okay, thank you. So on a related note, Jenny asked if raw food also includes salad. So like apart from raw fish, do like raw vegetables,
Yes,
would they?
again, this is data from Singapore. It used to be uh, that we have high gastric cancer, and then we went down. It was said that because we ate more unprocessed, it's a bit of we ate more vegetables then, in a
Mm,
way. So they were saying this is what the statisticians are saying. Of course, the end part of my talk is saying we should eat more vegetables and fruits.
mm,
But
mm,
there was some theory that in the past there was unprocessed husk, the rice which was not processed and
mm,
resulting in more stomach cancers. Um,
mm,
so salad, and I'll give again, salad can be very dangerous if not processed well. Uh,
mm,
you have a lot of incidents of salmonella as well
mm,
because of the proximity of now all our foods actually are industrial. So they are
mm,
grown with eggs and they are all processed. So if it's not washed properly, there might be parasite eggs on salad as well.
mm. Okay.
So in the end, you cannot tell, you cannot see. Um,
Yes.
yes. So
I
for
saw. Mm.
example, sorry, I'm going to
No,
belabor
no.
the point. For
Continue.
example,
Yes, yes.
um, you do not feed salad to young kids or babies. What I
Mm,
mean, young kids is babies, okay? Uh,
mm,
because their immune systems are not developed enough. So everything that the baby takes needs to be cooked. So no raw foods. If what they and we will say you can just take bananas because there's skin and you can peel, but you do not give them lettuce that is not cooked. Yeah. So babies
mm,
cannot eat that because there is a clear, quite a dangerous level of salmonella. As adults, we eat them because, like I said, the gastric juices actually kill a lot of the germs for us. But there is a predisposition. Yeah.
mm. Okay. So I guess the bottom line is if we are taking any raw food, just make sure that it's clean. I mean, for
Yes.
adults, and then
Yes.
of course avoid giving them to kids in case it wasn't properly prepared. Uh,
Yes.
yeah. Okay. Thank you. So we have a question from Ao Yong on gastric symptom. Is burn at the back of the chest. Is it considered a symptom of gastric
It
problem?
could be related to gastric problems because we feel what we call this is what we call referred pain.
Mm,
Of course, a burn or back pain could be related to your spine, could be, but it could be also related to the pancreas. It is
mm,
related to the retroperitoneal area and
okay.
pancreas, small intestine, stomach are part of this complex. So
Mm,
especially if it's persistent, you need to get it checked out.
mm, okay. And we have a question from Enoch on intestinal metaplasia. Uh,
Okay, so this is a
is,
very complex and rare condition. It can be uh, reversed, but often some of these may eventually lead to transformation into true cancer. Um, some of these metaplasia, and one of my slides says there was a promoter where you continue to irritate the metaplasia before it turns into cancer. So, how to manage? remove the irritant, whatever
Mm.
it is, whether it's smoking, or you have a predisposition for spicy food, you eat mala every day, try to reduce the injury or inflammation to the intestine, and then we just have to track and make sure that it doesn't develop further.
Mm. Okay. Thank you, Dr. Chin. And now I have a question on H. pylori infection. So, how do people usually get infected with H. pylori?
Okay, it is the answer is we don't know, because it may be present in our water.
Mm.
It could be something that you ate. It's a parasite. How
Mm.
the story goes is that this Australian doctor, scientist, he discovered it in a lot of samples of ulcers that he was treating, and then he was
Mm.
convinced that this was the cause of gastric cancer. And then to prove it, he actually swallowed uh, a vial of H. pylori bacteria, and then he actually got developed gastric cancer. Not the gastritis. He developed
Okay.
gastritis, hence proving that this was the etiological agent.
Mm.
And then I think he got a Nobel Prize for it. Yeah,
Mm.
but he might have regretted because later on they proved the link between H. pylori and gastric cancer.
Okay. So, did he get gastric cancer after that?
I don't
You
know,
don't
but he
know.
got gastritis. The story was he
Okay.
got gastritis. Yeah, because he was so convinced, and a lot of people said no, this was very common.
Mm.
It's not something that was related,
Mm.
but it is something that once if we find it, we can actually treat by a short course of antibiotics and remove the
Mm.
risk.
Okay. So, is H. pylori infection the only way somebody can get gastric ulcers, or are there other ways that?
Okay, there are, and I'm sure there
Mm.
is no one way, and there is many etiological.
Mm.
It just happens that H. pylori is something that we discovered. There may be
Mm.
another type of etiological agent that we have
Mm.
not discovered. Another
Mm.
Nobel Prize waiting to be
Mm.
discovered. All right, because not every gastric cancer is the same.
Mm.
When we do the DNA analysis, you got different types of. Uh, there may be another etiological for someone else. It may be another agent triggering gastric cancer, gastritis, and then the daily irritation may develop into metaplasia and then cancer, outright cancer.
Mm.
Yeah. So
Okay.
even stress, some people will say, I have a predisposition to stress and having stress ulcers. And then
Mm.
if untreated, may actually lead on to gastric cancer.
Mm. Okay. So, if we have gastric ulcer, then that would also increase our risk of getting gastric
Yes.
cancer.
Yes.
Okay. Thank you. And Christopher has a question on the cancer screening by 365. Does it use the blood test? Do you know if
Okay.
the
So that we are using the scope. So
okay.
we are offering the gold standard screening.
Mm.
So that is the scope.
Okay.
You see a doctor, and then we'll evaluate your risk, and then it is actually a scope.
Mm.
I think it is a up scope and down scope. Yeah, it's not just the up scope. So it is the gold standard, but there is a multi blood, multi cancer that we may be offering because it is more uh, convenient. I advise you to go to the 365 website uh,
Mm.
to read more about it.
Mm.
And there was a question about if the scope is normal, how often do I screen again?
Mm.
And usually, if it's normal, same like colon, you just need to repeat it 3 years later. Just do it
Mm.
for 3 years.
Okay. So seems like the multiple cancer screening test, they are using the blood test. So yeah, I guess for
So
Christopher, if
it's
you are
not
interested,
validated
just
yet, or it's not
yes.
yeah, but it is something that may be a gold standard in
Mm.
10, 15 years time.
Yes. Mm. Thank you. So now I have a question regarding healthy body weight. So you mentioned to reduce our risk of cancer, we should maintain a healthy body weight on one of your slides. So
Yes.
should we use the BMI as an indicator? Is that an accurate
Yes, it is an accurate
measure?
indicator. There are certain caveats to the BMI, and a healthy
Mm,
BMI is between uh, 20 to 25 uh, for Asians. Male and female slightly different. You can check. There are many calculators online that you can calculate. BMI is just your body weight in kg divided by your height in meters squared. So divide
mm,
by your height in meters 2 times, and you will
mm,
get a number. You know,
mm,
a lot of people are more than 25 overweight. If you're more than 30, then you're obese.
mm,
Uh, and the ones which BMI doesn't work so well if you are a bodybuilder,
mm,
then you have a lot of muscle, which is
mm,
very heavy and dense. You may have a BMI that looks obese, but no one will call you obese because
mm,
it's not fat, it's pure
mm,
muscle. That's why it's so heavy. So it doesn't work for people like that. Male and female females have slightly bigger body weight, so there are some adjustments.
mm,
Some base BMI calculators adjust for that, whether you're male, and even adjust for your age. Yeah. And
mm,
just to understand why would BMI be important for cancer prevention or risk prevention, because as the BMI goes up, a lot of the weight that comes in is actually fat, and the
mm,
fat for male it will be the beer belly, it be
mm,
around your tummy, the augmented fat around the belly. Once that's full, it will go around your heart. So you can imagine if your heart and if you do a CT scan, you see the heart full of fat,
mm,
wrapping around it. It's not something that is very pleasant because your heart will have to work harder. And it's actually, there are many machines as well that measure your visceral fat.
mm,
So gradually, after your heart, they will go to your liver. Anyone who has
mm,
eaten foie gras will know that we are making ourselves into little foie gras humans because it goes all into the fatty liver, which is a
mm,
very common condition in many normal Singaporeans because
mm,
of the tendency for us to overeat. Yeah.
mm. So if like I mean now we are talking a lot about like obesity, right? So what if your BMI is lower than the healthy range? Would that also increase your risk of cancer?
Yes, not to say that increase your risk of cancer, but there is always in moderation. If it's too low,
Mm,
it may be a reason why you're low. If let's say you're 19, then it's fine. You're a young
mm, mm,
female who exercises a lot and is just thin and dieting. But if you used to be 25 and you're dropping all the way to 19, then it's abnormal weight loss. And then
mm,
you need to get it checked out. So there's no
mm,
one BMI. Everybody has a different BMI.
mm,
We always say it's between 20 to 25 because
mm,
there's a bell curve of where most people, but like people, they are tall, they are short, they are
mm,
fat, they are thin. There is a basal weight for every single person. And we will know if you have tried dieting, you will not go down very much below your basal weight. Okay, you can
mm,
try all you like, but you're always at this weight. After a
mm,
point, and you feel healthy, you feel light,
mm,
you cannot go below that weight unless
mm,
you do something like an injection, Wegovy, and then you will drop.
mm,
But there is for everyone, there is a
mm,
basal weight. And it
mm,
tends to be nowadays, as we eat more, our basal weight goes higher and higher. So
mm,
that's why when you stop dieting, it rebounds back to that basal weight. That's the
mm,
basis of there's a memory of where our weight should be.
mm. Okay,
So that's
thank
why
you for
diets don't work. Yeah, if you
mm.
stop dieting, then that's the problem.
There's like a risk of bouncing back once you
Yeah,
stop,
there's a risk of
right?
bouncing back to
Mm,
our basal weight.
mm.
And it
And
relates
that
to our ancestry, to our genetics. Uh,
mm,
yeah.
and that's why we have to exercise regularly, right? Like you mentioned
Yeah.
5 days,
And in
30
between,
minutes.
quiz for everybody. And we just have a maybe quiz for you since the two of us having discussion. More important, diet or exercise in terms of maintaining weight?
uh, More important. I guess
Let's talk about
exercise.
that. Some people will say that, oh, you say exercise. Okay,
I guess
answer
it's
is
both, but
yes, of course, but I'm saying which is more
mm,
important.
mm,
The answer is actually diet, okay,
mm,
which contributes to the majority of, you can not exercise at all,
mm,
but if you control your diet, you will lose weight. Okay,
mm,
yeah. So there's also, of course, you can exercise a lot, and then uh, and also control your weight, and then you lose weight. But if you continue eating, no matter how much you exercise, you will still go and
mm,
gain weight. And this is the experience for most people. They can exercise, they go to the gym. I'm still not losing weight because they continue to eat KFC. Yeah. So, but if they stop and they eat healthily, immediately their weight will come down to the basal weight. If they exercise
mm,
some more, it will drop even further and faster.
mm,
So for lazy people like me, learning to control your eating is more
mm,
easier than actually doing exercise. Yeah.
true, true. So we have a question from Enoch on this case, Singaporean lady who suffered a cardiac arrest during gastroscopy in Korea. I'm not really sure if you saw that piece of news, but I guess it could on a broader uh, note, maybe you can share with us any side effects from gastroscopy.
So I'm unfortunately not able, and this is an unfortunate event. We do not know the specifics of what happened during whether she had a reaction or whether there was any thing that happened. Firstly, we don't know whether there was a reaction. Secondly, we didn't know what was the response of the doctors there after she had a reaction. Was there but what I read is also from the newspaper, there was a long period of deprivation of oxygen to her brain, and hence why she had this cardiac arrest. But the specifics, unfortunately, we are only speculating. There is always a risk of during anesthesia, and we don't know whether this is a reaction to the drug, reaction to the procedure, or but it is likely that it is related to anesthesia. Yeah.
Mm. So are there any typical like side effects that people can expect after having done a gastroscopy?
Um, okay. Of course, the doctor who will see you will say there are side effects.
Mm,
Firstly related to anesthesia.
mm,
And its effects, allergic reaction, risk of not waking up. Good anesthesia actually is very important. We have
mm,
forgotten that actually it's a very dangerous thing to do to put someone to sleep. They may not wake up. But specific to the procedure itself, there may be risk of residual pain, risk of perforation, risk of bleeding, and especially when you do biopsy, there may be uncontrolled bleeding. Yeah. So there are risks that you can decide and talk to your doctor if you're going for a gastroscopy.
Would their like appetite be affected after that?
Usually not. Yeah, yeah.
Okay.
In fact, you wake up and anesthesia is so great that you are talking to the doctor. How are you? How are you? And then when you wake up, it's already done. There is a
Oh,
memory lapse of you lost, and you just wake up and it's all done. Yeah.
mm,
So that's the effect of
nice.
someone who has gone for the gastroscope and colonoscope. Yeah.
Mm. Okay, we have a question from Jill regarding also H. pylori infection. So if like uh, the infection recurs after like 2 years or any time period, like is there a cause of concern?
Certainly, and I would think you need to consult your doctor whether
Mm,
the initial antibiotic given was not enough or there was a resistance of your H. pylori or something that is getting yourself repeatedly reinfected, whether it's the food you eat or the water you drink, because how it gets into your body is what you eat. That was
mm,
something that brought it into you. It is not sexually transmitted. It's not transmitted through kissing. It is either latent and it didn't manage to kill it off,
mm,
or it is a reinfection again. Yeah. So whether you have a favorite restaurant in wherever that you go, and there may be someone who is infecting you. There was a very famous story in UK. This lady called Typhoid Mary. She
Mm.
infected all her customers who went to visit her. She even got a
Oh,
nickname, Typhoid Mary. Yeah.
interesting. So thank
Yes,
you,
and
Dr.
I hope
Chin.
that many people got the answer correct. Diet.
Yes, yes, they got the diet part correct. So there's this myth, sugar feeding cancer. So do you think like avoiding sugar will help reduce the risk of getting gastric cancer?
Okay, then you should have attended our dear dietitian's talk, the 365 dietitian talk, and she's addressed it many times. We need sugar in all our bodily activities. Anything that we eat actually ultimately turns into glucose, sucrose, fructose. That is A level biology.
Mm,
Um, and there is no direct correlation. Of course, the cancer takes up more of the sugar, but we need sugar also for the rest of the body to grow. That's why if we starve ourselves of sugar, the rest of the body does not have the ability to fight the cancer or to have the immune reaction required to fight the cancer. So you shouldn't starve the rest of the body, thinking that, oh, if I have cancer, I reduce the sugar, the cancer will die. It is unfortunately not. It doesn't work that way. You
mm,
need proper nutrition in order to undergo treatment to get. And the biggest reason you can see that many of us will have a normal level of sugar, or
mm,
diabetics are not at a high level of gastric cancer risk. And all of
mm,
us eat sugar, but not all of us are going to get uh, gastric cancer. But
mm,
if all of us ingest Helicobacter, we will get gastric cancer. So
mm,
sugar itself is not a promoter
mm,
or initiator of gastric cancer. There are required other conditions required. Yeah.
mm. Okay. Thank you, Dr. Chin. So just one last question before we wrap up this session. So this is a question that I sort of thought of when I was looking at a slide about treatments. So you
Yes.
mentioned most of like gastric cancer can be sort of cured by surgery or radiation therapy, and
Yes.
like and in more less common cases chemotherapy. So at which stage of being diagnosed would then chemotherapy would be needed, and what are, I guess, the success rates of cure when you get diagnosed early?
Okay. So maybe I would like to make a clarification.
Mm,
Maybe it wasn't very clear.
mm,
Um, the treatment modality for gastric cancer is what we call multimodality treatment. That means we use both
mm,
surgery, chemo, and radiation.
mm,
And goes, of course, early gastric cancer, we do an operation, and then
mm,
followed by whether you require adjuvant chemotherapy to be based on the number of
mm.
nodes. Okay,
Yeah.
a lot of gastric cancer now, even stage 2, stage 3, adopt what we call perioperative chemotherapy. And
Mm,
now I just had just reading a new brochure of a new trial that came out where they
mm,
have multiple chemotherapies, something called FLOT
mm,
plus Durva, which is durvalumab, which is an
mm,
immune therapy, now shown to be superior to the gold standard now of just
mm,
FLOT. So you add chemo, followed by surgery, then followed by
mm,
more chemo, and then if they
mm,
are, then you add in surgery, radiation. So
mm,
each patient would be discussed. It is an individualized patient treatment. There's no longer, oh, this stage will only do this stage will only do this.
mm,
Depends on the patient's fitness, the depth of the invasion, where it is. Certain gastric cancers are easier to operate. The ones closer to the antrum or the tail end of it is easier to operate versus the ones closer to the esophagus. So the site
mm,
where it as well as the stage also determines whether the surgery can be done and how aggressive you need to be and the age of the person as well. You will not want to operate on an 80-year-old gentleman.
Mm. True, true. So in general, what is the sort of recovery rates for people who have been diagnosed at an early stage?
Okay. Unfortunately, the cure rates of gastric cancer, and I always say there are good cancers to have, bad cancers to have.
Mm.
The good cancers to have are, breast,
Mm.
uh, early colorectal, but the bad cancers we know,
Mm.
pancreas,
Mm.
esophagus. Unfortunately, gastric is the middle towards the bad
Mm.
side. Even the early
Okay.
ones will involve a very big operation. So,
Mm.
after changing your piping,
Yes.
the the cure rate is there,
Mm.
but
Mm.
there is significant side effects, what you call dumping syndrome. So they have to remove your stomach, and your stomach they replace
Mm.
with your small intestine. So it's never as good as your normal stomach. You are never back
Mm.
normal again. So unfortunately, gastric cancer is a bad cancer to have, even in early stages. But
Mm.
the worst, late stages are even worse. You can do a
Mm.
bad big
True.
operation and still not be curable.
So yeah, so it's just like a unfortunate side, but of course, as long as we get
Luckily,
it
it's
detected
only
early.
number five or
Mm.
although it's number eight, it's the number fifth killer
Ah, okay,
because
that's good.
the cure rates are not good. Uh,
Mm. So hopefully, yeah, there will be cures for it soon developed.
yeah, yeah,
Yes.
maybe immunotherapy. Yeah,
Oh yes. For sorry, one last question from Claire. Are there
yes.
instances where the stomach does not have to be removed entirely, or can we just do like a small little incision then remove that small little
Okay.
tumor?
I cannot comment on
Mm.
what it is, but in general, for cure,
Mm.
if it's early stage, we can do what I call subtotal. They won't remove entirely. If let's say there's a small uh, tumor at the antrum, they just remove, and what you call
Mm.
subtotal hysterectomy, you still have two-thirds or one-third of your stomach left, and they join up, and they have
Mm.
fairly
Okay.
results. Yeah, but those are rare.
Mm.
Yeah. So there are instances, but um, in general, it's not a good condition to have because uh, we only have one stomach. Very hard to join back.
Mm. True. True. And I guess it's quite complicated also, like
Yes,
given its
piping is
location.
always terrible.
Yes. Yes. Nice.
Colon
So
and gut, we have a lot, meters and meters of it, so we
yes.
can always join back. Yeah, if
True.
if
True.
there is 1 meter, even if you take away 1 meter, we have 5 meters left. But
Mm.
you can
Yeah. That's.
imagine your stomach is just one small bag. Even you cut a
Mm.
bit, it's very hard to join back. Yeah.
True. True. Cool then. So thank you, Dr. Chin, for sharing and answering all our questions, and thank you to our audience tonight for all your questions. So it's now time for Dr. Chin to take his leave. Once again, thank you very much for sharing your professional insights with us tonight.
Thank you, Bina. Thank you.
Yeah,
I enjoyed
thank
myself.
you.
Bye.
Do like, share, and follow us on our social media pages for the latest updates on our events. Once again, thank you very much for joining us tonight. Take care, stay healthy, and good night.